works.
It works?
Yeah.
All right. So we are on. And so today's topic is communicating with care. And I know I asked you how many of you are caring for someone. Let me ask you, how many of you are caring for someone who might have some sort of dementia or memory loss? Okay. How many of you might be caring for someone who has maybe hearing loss or maybe mobility issues, elderly? Okay, so it really is all of you, right? So I'm hoping that this will be helpful. And I do have a handout that I'm passing around. Some are 2 pages. If you need a handout, let my staff know. Jessica is back here. She can give you copies in case we run out. Okay, so what is it that we're going to learn today? In under an hour now, right? My goal is to talk about some of the steps and really understand the process of communicating. I know it's kind of weird, right? We've been communicating all of our lives, but sometimes communicating with someone who has memory impairment, has some cognitive challenges, might be having hearing loss, is a little bit more difficult for us to do. Identify those communication challenges, and then how to manage them. Okay? And then if anything, I want to leave you with some tips on how to help you do that. Okay? So feel free to jot down some notes. These handouts are for you. And or you can take a notepad. Okay, ready?
Yes.
All right. So in order to communicate, we have to go through a certain process. And this process happens rather quickly. So if we look at here in the blue, right? Think about even being here today. You obtain the information, right? You are all listening, right? You're all obtaining the information. It's what you see, what you hear. The second step is really to process that information. What is that person telling me? Right? What am I going to do with these words? You then kind of assess the situation and make your best judgment based on your experience, right? Oh, she's talking. I have to listen. You don't have to, but it would be great, right? So you start assessing. Then you begin to kind of formulate. Oh, listening means I'm not talking, means I'm paying attention. And that is going to get me to a response, which is hopefully active listening, taking down notes, acquiring that information. And then you communicate, right? If I ask questions, you answer, you might talk to each other, you might send this information down the line to somebody else. All of this happens in an instant. Let me give you an example. What happens if I'm turning on the stove? Do you remember the first time that you touched that fire on the stove? It's probably a long time ago, right? Maybe when you were a little kid, right? And you looked at it and you thought, oh, this is really cool. Look at all these colors. And it's kind of emanating some heat source, right? And so you maybe reach for it, and then what happened?
It burned.
It burned you, and how did you react? Ow, right? And maybe you start crying. You were 3. And you did this, right? And so the second time around that you saw this, you thought, what?
Don't touch.
I'm not going to touch that, right? That's hot. It's going to burn me. It's going to hurt. And so then maybe down the road as you became an adult and you had your own kids, you told the children, you shouldn't touch that. That's hot, right? You're communicating, right? All of that happened in seconds, in an instant. And now you have that memory, right? You have that knowledge that you shouldn't be touching fire or you're going to get hot. But what happens if you have memory loss? What happens if you have cognitive decline? And you can't remember that when you touch that nice looking thing that's moving around, it's going to burn you. So now what happens? You get burned. So do you see where I'm going with this? So this is something really simple. Communication is something really simple. But if a person cannot hear, if a person cannot see, if a person has cognitive decline, That's easier said than done. Okay? And I wanted to give you the scenario so that we could kind of start putting ourselves in their shoes. We can know the difference between fire and it's hot and cold and it's icy, right? But they might not understand that. And by us understanding that, then it takes away the frustration. How many of you get frustrated? It's okay, we're amongst friends, right? Because you just repeated, don't touch the fire. It's gonna burn you. How many times do I have to tell you? But the person is not going through this process. Do you see what I'm saying? Okay. And that is this visual here. You know, this is what I want you to remember, that sometimes that person might ask themselves, you're saying it burns. I don't know what that means. What is burning? What is fire? What is hurt? What is pain? I mean, there's so many things that that person could be going through in their mind. So what we need to do is we really need to kind of look at things from their perspective, right? What are their changes? So what are some of the changes that you see in the person that you've been caring for? Physical changes. Deterioration of? Like?
Lethargic, depressed, can't move.
Okay. Can't move. What else?
Doesn't want to move, or just, doesn't want to go and do
Okay. What else?
it.
Memory loss. Okay.
Confusion.
Confusion.
Lack of interest.
Lack of interest. Thank you. Anybody need another handout?
Yes.
Oh, okay. So she'll give you the handouts. Yes. I think that's the AC.
Oh, wow.
Yeah, it's the AC. It will turn off in a little bit once it gets cool.
Ready?
Oh, coffee's ready if anybody wants coffee. Okay, so physical. How about vision? Hearing loss. We talked about those, right? How about inability to walk the way they used to? And maybe now they have a walker, right? Have you seen people that maybe walk like this and shuffle their feet? Have you wondered why? Balance, a lack of adequate, perception, depth perception. So if I see different colors, I don't know if those are steps, so I'm gonna try and figure it out so I don't fall because I'm scared, right? So I might just start walking like this instead of walking like that, right? So those are physical changes that you might notice. How about some cognitive? And some of you mentioned them, but I just didn't want to highlight them yet. But how about some cognitive changes that you might be seeing? Memory loss,
Difficulty in making decisions.
right? They can't make decisions, and that might frustrate you.
Can't get the right words out and stutter.
Yes. Can you give me
Vestibular.
the thing? What is it called? The fork. The fork. That's not a fork.
Oh,
It's a pen, right? So there might be some confusion. You were going to say something?
Putting sentences together.
Putting sentences together, yes, and that gets really confusing, right? What we see sometimes in people who have some sort of memory loss or cognitive challenges is that they might revert to their first and their native language. So if a person, as the child, spoke a different language, they might start reverting to that initial language. And so now the family's confused because, you're saying, I don't know, another word for something, and you're like, what are they saying? I don't understand. So cognitive decline you might be noticing as well. What else? Am I? Yes.
Repeating old memories. Like
Yes.
I had a patient who always thought that she was going to a party, so she always had a purse with her, and she thought that she was going to be seeing her family who owned a restaurant, but they're not even like alive or anything. She just, so I always had to make sure that we're really nice with her. Like, okay, just wait, we'll have dinner. But I want to see my family. Like, oh, your family's out on a vacation. We didn't, so she didn't upset her because if you said what really happened, she would be like crying. So, old memories.
And that is a good tip. And I'm glad that you mentioned that because we can talk about those later. But sometimes it's more detrimental to even explain the actual truth that is happening because the person might not understand. What do you mean my family is dead?
There
Like,
are,
what do you mean they're gone?
yeah, they're gonna, well, if you keep on repeating every time she does, which is every night, then she's gonna go and cry. maybe
The whole
think
night,
over
it's
and over
not-
again.
yeah.
It's like, no.
That's not good. Yes. So that's good that you kind of redirect and yes. Oh. Yes. You go first.
Me?
Yes.
Okay. I'm a logical person, so my biggest frustration is the lack of logic, and I guess that's part of the cognitive decline. And I'll give you an example is my wife is incontinent.
Mm.
So she'll wake up and she'll be soaking wet. So I said, okay, well, let's go in and take a shower. But in order to do that, you have to take off your clothes.
Mhm.
Why do I need to take off my clothes? Well, first, you have to, because you can't, the logic says I expect her to realize that you don't get into the shower.
It was the line of people, right? The thinking process, which she doesn't have.
Yeah, she doesn't, that's gone.
Mhm.
So,
Yeah.
we fight and argue, but then I just walk away because I've had some other classes and it says don't, argue with them, don't engage.
Yes.
So I'll come back later and I'll say, okay, it's time to take a shower, you need to take your clothes off. Oh, okay. So then.
Good. But it is frustrating at
Oh,
first,
my
yeah.
God.
Yeah. Yeah, I agree.
I think with the memory stuff too, it's what I get frustrated with my mom is like.
Could you speak up, please?
Sure.
Thank you.
With the memory stuff with my mom, what I get frustrated with is when she can't remember that she just ate, so she wants to eat again, or she left the oven on, and then I'm like, what's burning, right?
Mhm.
So the ways that she could kind of be harming herself, because she doesn't remember that she forgot to turn something off, or like, now we have no food because she ate, 8 times that day,
Yeah,
And
absolutely.
She still doesn't,
And she doesn't understand. And you get frustrated because she just ate. Those are all valid concerns. And it doesn't make you a bad person if you get frustrated. We're all human. And we want the best. I mean, anybody, show of hands, or maybe not, wants to be the worst caregiver possible. Right? None of us. I mean, really, we're in it because we love that person and we care for that person and we want to do the best that we can. But it is frustrating. We're not in that situation. Okay? So once you understand and kind of put yourself, kind of step out of that frustration and understand, oh, she doesn't get it. She doesn't see it. She cannot rationalize. Then we can come back to it and be like, okay, redirect, we'll talk about some tips. Okay, so what I tell caregivers to do is to become detectives, right? Because like how I said, if I ask you a question, you're going to respond, right? I have that expectation, and you know what to do when I ask a question. But sometimes the people that we are caring for don't understand, or they keep repeating the same question over and over, or they don't know what's going on. So then you almost have to become a detective to figure out what is it that they're really telling me, right? Like when I was going like this, can I borrow the thing? Hopefully he can figure out, oh, she means the pen, right? So here are some problem-solving strategies that I want to talk about. Okay, so identify what the behavior is telling you. Not so much the words or the lack of words, but what the behavior is telling you. Formulate an effective action plan. We'll go into that. Adjust your expectations when communicating. Right? Again, if I ask her a question, I expect her to respond. But knowing that she might have some cognitive decline or memory loss or communications challenges, then if I ask the question and she doesn't respond, it's expected. Okay? Instead of getting frustrated. So this is a little tip that I have for you. Okay? And I call it exploring the pieces. And when you find yourself in that situation, where the person is telling you something, but they're not really verbalizing and it's not very clear, then we need to figure out what they're telling you, what their behavior is telling you. So, is their way of communication due to some physical complications, right? Maybe the person doesn't want to tell you that she's incontinent and is embarrassed, but then you have to figure it out. Oh, that's what was happening. That's why she became so withdrawn or angry or embarrassed. Are there some intellectual changes, right? Now the person doesn't know that that's called a pen and says fork. Huh. So now I know that in her language that might mean pen. How many of you have had little kids? When they were babies, did they just born, once they were born, start communicating, hi mama, would you please hand me the pen? Right? So they started doing the goo goo gaga thing, right? And you would figure out, oh, she wants that. She wants up, right? She wants to sleep. You kind of developed your own language. And other people, other friends might be like, what is she saying? Oh, this is what she wants. So it's almost the same thing. What is it that they are already communicating to you that now you know it's something different? That is fork, she means pen. Emotional. You know, we forget sometimes that the people that we are caring for are that people. And that they also have their emotions to deal with, right? So if they know that their family, they're there to visit the family, but they don't see the family, then their emotions might kind of start bubbling up. I'm alone here. How come my family's not here? Right? And instead of telling them, oh, they're not here because they're gone, then finding a different way to redirect could be more of a benefit. Capabilities. The person is no longer able to go to the restroom. So now you have to help them. You have to find different ways of getting them to the bathroom or showering or walking. Environmental. Okay, so somebody said right now that kind of the buzzing from the AC is a little annoying, right? And if you focus on it, it could be, right? Maybe we just kind of hopefully try different strategies and forget about it, right? The environment might play into that discomfort, right? If it's really annoying, now I've made reference to it, right? Now I've highlighted the noise, and now everybody's gonna hear that buzzing. But now that might be a distraction for people because it's too cold, it's too noisy, there's too many people, there's too many kids, it's too loud, right? Or social. Sometimes the family members might think, wow, she's become really withdrawn. She was the life of the party. And now she is totally the opposite. Has that happened to some of you?
Yes.
So that could also have a negative effect on people. And it might be because somebody reminds that person of somebody else. Maybe going to that park meant family barbecues and they don't see the family. I keep using that example, but I think it's a great example of how that could be a negative. So then we as caregiver detectives have to figure out what is it that this is all telling me. And even added to that might be medication, right? If somebody's taking medication that has negative side effects, or causes the person to have to urinate more, or causes the person to have pain somewhere else, but they're not telling you. So then, I noticed that once I started giving her this medication, she started acting like this, and that. Maybe it's the medication. Hey, doctor, can we do something about that? Yes.
I work with some kids with special needs, and we're trying to look at the function of their behavior. There's like primary basic functions like avoiding tasks or reading and eating,
Mm-hmm.
physical, sensory, or
Yes.
internal. So we have to start looking at the behavior for the function, not so much like
Yes, I know exactly what you're saying. So I have using what you're saying, that looking at the function of the behavior to try to deduce to what they're, what is happening. So my aunt, I got to share this story with you. My aunt sometimes would sit in the living room, and she would just kind of pull her hair. And when she would pull her hair, I would tell her, what? Stop pulling your hair. You're gonna go bald, right? And she would listen, but then 5 seconds later, she would start doing it again. So what I had to do is I had to figure out, what is the behavior telling me? And I went through this list. Does she have pain? Is she trying to communicate something? Does it bother her? Is it medication? I finally figured out that she was good old plain bored. I thought putting her in front of the television because that's what she wanted to do was a good thing. And it's not like I put her there for 8 hours a day, but even for that, hour that I had her there, I thought that that's what she wanted. She got bored. She felt, she wasn't interested anymore. So then I knew that I had to give her some sort of activity. And she wasn't communicating that, but once I found the activity, which ended up being gardening, which she liked, then she stopped pulling her hair. She wasn't bored. But it took me a while to figure that one out. Yes?
When I was watching my mom, she was in her 80s, and she was put on antidepressant meds, and she started acting pretty hyper and doing a fake British accent. And we were wondering, what in the world's going on here? My mom, we're Connecticut people, we don't have a New England accent, but we figured out she probably was copying her grandfather, who was from England. But we told the caregivers, please take down the medicine, and as soon as they did that, the accent went.
And she wasn't telling you that.
She
You
didn't
had to
know.
figure, exactly, she didn't know. So
Yeah.
that's a great
And other
example.
caregivers figured that was natural. Other new people, they thought that was the norm, and it was not,
Yeah. Good, thank you for sharing that. So then what do we need to do now that you had that pieces kind of way to figure out what's happening. Now what we need to do is figure out what our goals are. What is it that you are as a caregiver trying to accomplish? Are you trying to do things for them or with them? Right? Are you trying to go to a party and enjoy a day together? Or are you trying to bait them? Because that's also going to be different, a different response, right? It might be challenging in different ways. What are the goals? What is it that you want them to understand? How is it that you want them to respond? Right? If you're talking about food and meals, you want them to eat. But if they thought they already ate, or the opposite, you're saying that she just wanted to keep eating, then how are you going to, what is your goal? Are you going to let them eat? Or are you going to curb some of that eating? Right? Figure out what is it you're trying to accomplish. What is your goal? And I have this mirror here because I think from time to time we do need to look at ourselves in the mirror. Right? It's a reminder that sometimes the way we approach the situation makes a difference. If I tell him I need him to give me the pen and he gives me a fork and I yell at him because I said pen, but he understands pen means fork, so then what is going to start happening here? Resentment, frustration, anger. I don't want to take care of him anymore. It's just, he's too difficult. Have you heard that from other people?
Yeah.
And so what we need to do is we need to really look at ourselves. It's kind of like what we tell little kids, right? It's how you approach the situation that's going to make a difference. So how many of you have gone frustrated within the last, 24 hours? This morning, right? All of you, right? When you get frustrated, you got to have a toolbox of how to de-escalate the situation, okay? And it's whatever works for you. You know your situation best. You know yourself best. You know the person that you're caring for best. You know what works. So is it stepping outside, take a deep breath, and then come in? Is it tag team, you're it, I gotta take a break, you deal with her? What is it? I mean, what are some of the things that you do? Humor. What else?
I just walk out of the room.
Just walk out of the room?
I have to.
You have to. Mm-hmm.
I remind myself how precious this is right now. It's gratitude for the moment.
Gratitude for the moment. And that's hard because you're in the middle of frustration, and how many times do we say, oh, this is great, right? You're going to say, same as him? Yeah, I just walk away.
I want to hire him.
Right? He needs to put it in a bottle and share it with us. Yeah, absolutely. So how we look at ourselves and change those expectations makes a huge difference, right? If I tell him, I know I keep picking on you, but let me know if you don't want me to pick on you anymore. Okay. If I say to him, give me the pen, he might grab it and throw it at me, right? But if I say, would you mind if I borrow that pen? What's going to be the reaction? It might be, it's a nicer reaction. He might give me the pen. It doesn't mean he will. He might say, no, it's my pen. But at least there's a higher probability that he's going to respond in a more positive way. Okay? So how you present yourselves makes a difference. So check your body language, right? I mean, if you need to write these down, go ahead. Are you calm or are you frustrated, right? How is your approach? I know it's not a fork, but he thinks it's a fork. Does it matter as long as he gets the thing, right? Using humor and cheerfulness, right? Oh, you're so silly. Okay, whatever. Use touch. Many times we forget we're social beings, right? I mean, look at us. We're kind of starting to coalesce amongst ourselves and really kind of learn from each other, hopefully listening to these stories, right? I'm actually, the idea behind this is that at the end you might get to know this guy and talk to him about how he does it or how everybody else might benefit from your situation. But using touch, may I? If I say, hi, how are you? She might respond in a more positive way. So
If you do that all the time, I'm going to think there's something wrong with you.
Well, that's why you have to know the person. You have to know the person. Absolutely. Yeah.
If you do that all the time, you're a doormat.
Then that's why you have to figure out the situation. Yes, you have to figure out the situation. You know the person best. And then end the conversation in a good note. You want to eat again? Okay. Yeah, you know what? I have some gardening outside. Why don't you come and help me for a little bit? And maybe that will distract them. Okay? Okay, so here are some communication skills that I want to share with you. And I think you have them in the back of your sheet. And the first thing that I want to tell you is more than 70% of our communication is nonverbal. Did you know that? So if I see, I'm going to pick on my friend Pam over there because I know her, we're good friends. And if Pam is sitting in the back like this, what is that telling me? I'm boring her out of her mind, right? She's not. She's totally taking notes. Look at her. She's totally hanging on to every word that I'm saying. But if she's showing me that, I might be like, oh, wow, I'm really boring. Am I boring everybody else? Is everybody else falling asleep? Oh, my goodness, What we need to do is we need to also practice what I call PAL, active listening. She might be like this because she's tired. Maybe that's how she gets comfortable. Maybe she's really comfortable. What we need to do is we need to ask. We need to activate our active listening, which is different than hearing, right? I hear words, but am I listening to those words that I'm hearing? See the difference? So here are some examples of difficult communications that sometimes we have with other people that are not just the caregiver, or the care receiver, I'm sorry. Okay? So we might be having these difficult conversations with a doctor, and we're talking about diagnosis, right? You said, what? Dementia? What is that? With other medical professionals, right? Nurses, maybe even over the phone as we're making appointments. Medications. What does that mean? I don't understand. Do you get the prescription and it's written and it looks like chicken scratch, right? I don't understand. I'm supposed to take them at morning and night and with food and without food and what? Right? So it is important to ask questions and listen to what the person is telling you. And if things don't make sense, feel free to ask questions. Because you're asking questions not only on behalf of the person that you're caring for, but for you. You're the caregiver, so you're probably administering some of these medications yourself. Yes.
Okay, let's go talk to another person who's not into dementia and stuff like that. Well, if you're talking to your person that you're giving care to, and they say something you don't understand, they say, I don't understand what you're trying to say. And they say, well, you're really stupid. Anyone would understand what you're trying to say. And that, having post-traumatic stress disorder combat myself, which is an anxiety disorder, that really escalates the issue with me. So we wind up having this
Yes,
bumping heads together
absolutely.
thing. And my big concern is in the moment, you know, I can rationalize this is a disease, it is not her. But in the moment, since all of the things is normal about her, how do I react to that? How do I control myself?
And that's the key. That's $1 million question, right? Because you are all individuals, and every single person that you're caring for is different. Even if everybody in this room was caring for someone with dementia, I guarantee every single person that you're caring for is different than the other person that we're all caring for. So how you react is based on what you know that works for you. If you have anxiety, if you know that's going to set you off, then you have to have some sort of plan B, C, D, E, and F in place, right? When this starts to happen, notice your body. Notice yourself. We have to be really in tune to our bodies, right? I tell my children all the time, it's okay to be angry. Know that you're angry, but then figure out how you're going to deal with that anger. What are you going to do about it? Yes?
I think the key word he used was reactive, and I, working with my disabled adult brother, have to be proactive. I have to anticipate that there's going to be times in the day, food, bathing, getting ready for work, whatever, those are going to be my touch points where I'm going to have difficulty.
Yeah.
So I have to have that plan B through F.
Yeah.
And just, when you do that, you have comfort in having tools to respond to it.
Absolutely. And having people help you is good, right? Because other people might be able to step in and anticipate it. I'm so glad that you're saying that, anticipating a certain situation. We're going to go to a birthday party. Whew, okay, well, there's a lot that could happen there, so then we need an exit plan. If things start to escalate, we need to tell people, okay, don't worry about us if we have to step outside or if we have to leave. Don't take it personal. Don't get upset. We love you, but we really need to go to plan B now. And even informing others of how you're dealing with the situation might be helpful. Yes. Okay, so having the talk. And I put it like that because, you know, it's funny, right? We talk about the talk with your teenage kids, right? We really need to think about how we have the talk to the care receiver, to the family around us, to friends, to neighbors, to medical professionals. Because we communicate and we interact with these people all the time, but things change. So what we need to do is we really need to clarify the need for the conversation, right? Let's take the birthday party, for example, that he was talking about anticipating the challenges, right? Okay, friends, we'd love to go to your birthday party, but it might be a problem, so just know that we might have to leave early. We need to let you know. And you can apply this to anything, really. It doesn't just have to be other people, but it could be to the person that you're caring for. Determine who should be in that conversation.
I assume we're not talking about sex at this point.
No,
Okay.
but thank you for clarifying the conversation. We do have a talk that talks about intimacy and dementia, so stay tuned for that
No,
one.
I don't want to. The talk, I sort of,
Yes.
never mind.
She's trying to be funny. See, I like that. Who should be in this conversation? Who do we need to get involved? Have you heard of people who are concerned about their loved ones who might be driving? And that they're elderly and so their reflexes are slower now. Maybe they have eyesight problems, depth perception problems. They keep crashing into things.
They don't have a driver's license?
They don't have a driver's license. They want to drive.
Play with them?
Hey, see? Come up here. Right? That is a very valid and concerning conversation that many caregivers have. What do you do there? you can have the talk, right? You need to figure out who's going to be there. What family members are going to be there? Are you going to include the care receiver as well? You can. It just depends, right? Do you know that person? So determining who should be there. Have an outline of what is going to be discussed. And not because I'm trying to make it very formal and you all have to dress up to have this talk, but really because there's so many emotions that go with these types of conversations that you don't want to veer off course. You want to make sure you cover all the points. You know, it could even be talking about who's going to take care of mom on the weekends or during the week or while I'm on vacation or while I'm working, right? That could be the talk. So how are you, what are the things that we need to discuss? Bathing. You know, you can make it as big or as small as you want. Sort it out. Okay, so if you have 3 siblings and one says, I'm going to go on the weekend, I'm going to go during the day, I'm going to go in the evening, right? Those conversations are going to be a little different based on what the needs are. And then explore both sides, because sometimes we forget that it's not just our emotions, but it's also the care receiver's emotions, and it's also the other people who are involved. You might be already aware that, okay, mom she's incontinent and she needs to wear some sort of diapers. And mom might not be cool with that. And a family member might not be cool with that. But you know that that's probably something that needs to happen. So then you need to have the talk. Right? And figure out how to problem solve. And you don't have to come up with all the solutions to all the problems, right? That's why you have organizations like ours that can help you figure those out and can connect you to other resources, other community organizations, other things that are available. You know, we are really lucky to live in San Diego County because there is such a big movement to really integrate social services for the aging population. There is a lot at every single city, and I'm involved with some of these projects where they really try to make these, call them aging communities, where things are being addressed such as transportation, such as senior centers, intergenerational activities, healthcare. Not all the cities have this. Not all the counties have this. I mean, sometimes people think that Florida has these, but we have a really robust resources in the community. So I really want you to take advantage of that as you go along. You don't have to figure it out yourself. That's what I'm trying to say. Okay? Okay, so here are some types of communication methods that I want to leave you with. Passive communication. And I know I'm breaking it down. It seems kind of simple, but hopefully in the moment you can figure out which one you're doing so that you can react accordingly. What is passive communication?
It could be nonverbal, I guess.
Touch. So I'm going to say Lucy says, close enough. I really wish Lucy would just kind of step in and give me a hand. But I'm just, she's just sitting there. And I'm dealing with all this. Can she read my mind?
No.
Right? So then I start being kind of negative towards her because I want her to do the things that are in here. But I'm not telling her. Is that fair to Lucy? No, right? How about some aggressive communication? What is that? We don't know that one. Give me an example.
I've asked you 3 times to help me out with this. And what do you say? No, I'm busy.
Very good. Good example. Yes. So is that effective?
No.
No, not at all, right? It gets everybody frustrated. How about that one? What is that? Straightforward, honest. Is that a good thing or a bad thing?
Why?
I mean, it's
Depends on the person you're communicating with.
it depends on the person and how you maybe are communicating, right?
So true, that's very true.
Yeah.
Right. I think you just need to agree, that's very good.
Absolutely. It depends on the person that you communicate is how you're going to do this, right? And hopefully more this than these. but it's also, you can be nice and be direct. You don't have to be mean and be direct. Hey Pam, do you mind handing me the book? I need the book, thanks. That was direct, but it wasn't like, give me the book, right? Yes?
I'm just gonna say that I think the hardest thing about this is that sometimes no matter what type you try, it won't work.
Yeah.
So you have to do it thinking, okay, I will try direct, but if it doesn't work, I'll try to withdraw or accept that it's not gonna happen, rather than slip back into one of the other ones.
Yes.
Because it is so annoying if you, often if the person's difficult, you might have spent a whole evening thinking about how you were gonna say something, and then you finally come out with it and you've got it all perfect, and then it doesn't work.
Yeah. Yes. So what we're doing today is we're really filling up your toolbox with tools that you're going to take out based on the situation, based on the challenge, based on your state of mind, right? If you're maybe more calm, you might try some of the other things. If you're more frustrated, you might try other tools. But it's what works for you. Does that make sense? Okay. So adjusting expectations is exactly what you were just talking about. That you might have this formulated plan that is great. It's foolproof. I stayed up all night. I know this, and I'm using my direct voice. I'm being, calm. And I'm going to approach with kindness. And it's totally it's going to go sideways, right? So we need to adjust those expectations. Is the place free of distraction? As you're trying to have this really important conversation about, Mom, maybe you shouldn't be driving, you might not want to have it at Starbucks, right? It's not private, and it's very noisy. Allow time for information to sink in. And I'm not talking about like 5 minutes. It might be taking a couple of days until Dad realizes, I guess my kids are right. I shouldn't be driving. The tone of voice that would also comfort you. Again, we need to put ourselves in this situation. What if we were in their shoes? How would we want them to treat us? How do we want to be treated? Right? And if the conversations become stressful, then redirect. Again, using the example of the lady at the park, right? Okay, yes, let's go over here and let's get some coffee, right? And then empathize. We are not there. You're all doing a wonderful thing, which is caring for the well-being of another human being. It's not easy. But understanding that they are in a different place that's different and more challenging than you, hopefully in those times of frustration, can get you at least to stop and think. Right? This is pretty bad. How can I make it not more bad? Right?
I worked with a male patient once, and he was in the military, retired, he had brain surgery, he was married. His wife wanted me to use always a gate belt for him, but every morning when I would wake him up, he did not want to use the gate belt. And I would tell him, should I call your wife? He said, no, I don't want you to call my wife. And one morning he got up and he fell in the bathroom because he didn't want me to use the gate belt. And I told him, should I call your wife? He said, no, don't. And I was like, I think I should call your wife. But he was very, very stubborn because he always thought he could take care of himself. And he made it really hard for me to take care of him. It was really, really hard. And he would smoke a lot of cigarettes. He would always take breaks outside and smoke a bunch of cigarettes. And this guy's went through brain surgery. He didn't even care to really take care of himself. And getting to eat, he didn't really want to eat breakfast. It was really hard. What I'm mainly wanting to tackle, work on, is working with male patients who are like that, because this wasn't good,
Yeah. And that stubbornness that you talked about can also be an issue, and you can't really take it away, right? That's the person's personality. So then it's how you work with that stubbornness. My aunt was very stubborn. Very stubborn. The first time I bathed her took me an hour. and not bathing her, getting her in the shower.
Yeah, well, the gate
It
belt
was a challenge.
big deal thing.
Yes.
I was trying to push him to use that. He didn't want to use the gate belt. I guess
Yeah.
he thought in his mind that he doesn't need it. He does need it really
Yeah.
bad. His
But
back-
you know that
Yeah.
he doesn't want to do that. So then figuring out how to get him to do that, you might need other tricks, like you're saying calling the wife. You know, there might be other things that you might do to get
Even
that
with that, he
person.
didn't want it. He didn't want me to
Yeah.
call his wife. It was really hard. This one.
Yeah, it's a challenge.
Yeah.
Yes.
Yeah.
What did you find out was the main reason your aunt didn't want to get into the shower? Because that's something that I.
Yes, it took me a while. It took me a while. It took me days to figure this out. I can remember being a detective. It was a very simple thing. Shower, you need to shower. It's time to shower. Shower. What's the big deal? It took me a while to realize that she saw me as her little niece. We lived next door to each other. She was like a grandmother to me. She was my great aunt, but she was like a grandmother to me. So for her, I was a child that was going to get her naked. And it was such an invasion of privacy for her. It was embarrassing, and I needed to kind of step away and figure out how I would feel if I was in that situation. So I had to get different tools. I had to involve her in the process of selecting, scents that would be pleasing to her. Again, this took a while. Not that I didn't bathe her. I'm saying every time I got closer and closer to where she said, "Sure, let's go take a shower." Right? And so that was part of it. The other part was I had to get somebody to distract her while I left and came back, and I was this lady that I was gonna bathe her. So I almost had to kind of play a different persona for her to realize that I wasn't her little niece, but I was this lady that was gonna help her in the shower, and it's okay. I'm not gonna look like I'm gonna cover you with this towel. I'm not looking. Here's the soap. Here's the washcloth. Let me know when you want me to take the shower. I did a handheld. I had to change it so I can make it easier.
Okay, so
I've seen it all
sometimes
before.
Yeah.
my wife doesn't see me as her husband, but as her father.
Mm-hmm.
So I think that might be part of it, and that's what I've had to deal with and had to reconcile. I said, well, maybe that's what, 'cause sometimes in our normal, in our routines during the day, she'll say, make an implication that I'm her dad.
Yeah, and that could be it, because that was it with my aunt, and so
My mom
it's.
calls me mommy once in a while. Thank you, mommy.
Yeah, and it's hard as a caregiver to hear that, right? Because you're not the dad, you're not the mom. I was her niece, but I wasn't this. I was her caregiver, so it's really trying to deal with those emotions ourselves, and then go back and say, okay, well, here I'm going to use this tool this time and see how that could work. Okay. So before we leave, I just want to really quick show you all of the services that we have. And we have, if you're not connected to our services, everything we do here is free. And it's for the family caregiver. It's for you. It's to help you. And it's wonderful because if you've been upstairs, we have a library that is also free that allows you to check out books and videos and bring them back so other people can use them. And we're always expanding our library. We have counseling sessions where you can talk about your frustration, your anxiety, your challenges. And there's no judgment because we understand it. We've seen it all.
Great.
Oh, good. Thank you. Thanks for the plug. Also, if you have any questions regarding legal issues or financial issues as it relates to your caregiving situation, we partner with law firms that do that, and we pay for the initial consultation. We have respite care for our clients, so that's why I encourage you to be a client, because if you ever wanted to get a break from your caregiving responsibilities, let's say you wanted to go to a wedding, your daughter's getting married, and you can't take mom because she has dementia, and it would be too difficult, but you can't leave her. So what do? We can figure that out for you with your care manager, who walks you through every step of the process of caregiving. And every situation is different, so you could always have someone to talk to and connect with. We have support groups throughout San Diego County in English and Spanish. Education and training is what my staff and I do. So if you haven't already, make sure you take a list of all the classes that we have. These are just classes here that we do every month, but we also have classes throughout the county and workshops and conferences. So if you see our flyer or if you want to check out our website, you can look at the calendar, you can see what else is coming down the road. Employer resources. A lot of you, I think, it might be in that sandwich generation where you're caring for your parents, but you also might be caring for children. So this is why we do the live stream. We have podcasts. We have tip videos if you haven't seen them already on our website. They're 1 minute, so that on different topics. So you can even watch them on your phone, and you can just for a minute, just get some more tips on how to, increase your tools in your toolbox. Reach to caregivers, and this is where I think Rosario might be able to talk to you more about this. It's a program that is specifically tailored for caregivers who are caring for someone who has dementia, memory loss, or Alzheimer's. It is an evidence-based program given by master's level clinicians and licensed clinical social workers, and it's really an evidence-based program that helps you understand what's going on and get some more tools on how to manage someone who has Alzheimer's, dementia, or memory loss. Okay, so make sure you sign up with Rosario because she can give you more information about that. Then Operation Family Caregiver is for military and veteran families who might be caring for someone with TBI, PTSD, or some sort of physical disability. Didn't have to be sustained during war, but we do understand that sometimes that's another challenge. And we're seeing a lot of younger caregivers because they are caring for people who are coming back from conflicts, and they're not necessarily in their 60s, they're younger than that. And so now you're dealing with children in the home and instability, so we help with that. So if you know of anyone who might benefit from these services, let us know. Here's our contact info. We also have brochures that Jessica can give you. And if you want to stay behind so that you can have some coffee, but I can take you upstairs and get you connected today to these services, okay? So that you don't have to leave without knowing that, there is no help. We can be there to help
If you're
you.
interested in respite care, how
Okay.
can we set that up?
Talk to me afterwards. Yes, I'll talk to you. Yes.
If I'm missing anyone to register, please meet me at the end to sign in to have you that you came into the class, please. Thank you.
Thank you. Thank you for coming. Thank you so much. Yes. Let me just turn this off. I think.
So we actually registered, we have a member that